Welcome to another lecture by MedicoMedics, Cardiovascular Pharmacology. In this lecture, we will discuss drugs used to treat hypertension, ischemic heart disease, heart failure, arrhythmias, and hyperlipidemia. And as always, we will end with a summary. So let's get to it. Now, this branch of pharmacology focuses on drugs that treat diseases of the cardiovascular system. So we study drugs used to treat heart and blood vessel diseases. We're talking about some of the most common and high-impact conditions in medicine. For example, we have hypertension, which is high blood pressure. We treat ischemic heart disease like angina or myocardial infarction, i.e. heart attacks. Furthermore, we talk about drugs used for treating heart failure. This is where the heart can't pump effectively. We use it in treating arrhythmias or irregular heartbeats. And hyperlipidemia, so high cholesterol. Now, these medications don't just manage symptoms, they actually save lives. So let's break down how they work. Now, let's begin with antihypertensive drugs. So these are used to treat hypertension and involves several classes of drugs, each targeting a different mechanism to lower blood pressure. We have, for example, diuretics, ACE inhibitors, ARBs or angiotensin receptor blockers, calcium channel blockers, and beta blockers. Now, in the scope of this lecture, we won't deep dive in detail on the mechanism of action of each of these, but you can check our physiology lectures on the cardiovascular system. Now let's go on with diuretics. Now diuretics, like hydrochlorothiazide, they work by increasing urine output. And if you increase urine output, you're going to have a reduction of blood volume. And if you have that, that will lead to decreased blood pressure. Then we have ACE inhibitors. They block the formation of angiotensin II. An example is enalapril. And angiotensin II is a hormone that normally constricts blood vessels. So by preventing its formation, blood vessels stay relaxed and pressure drops. If you're curious, check our lecture on the RAS system, or the renin-angiotensin-aldosterone system. Now, another class is the ARBs, a close relative of the ACE inhibitors. What they do is they block angiotensin II at its receptor. An example is losartan. So it achieves a similar result, like the ACE inhibitor, by blocking angiotensin II. But it does it without stopping its production. Then we have calcium channel blockers. So an example is amlodipine. These relax blood vessel muscles to lower resistance. And by reducing resistance, we get a better blood flow. Finally, we have the beta blockers. So an example is propranolol. These lower blood pressure by slowing the heart rate and reducing the force of contraction, thereby decreasing cardiac output. So each class offers different benefits and side effect profiles, and treatment is often tailored to the patient's specific needs and risk factors. Next, let's discuss drugs used to manage ischemic heart disease and angina. Now then, let's move on to drugs we use to treat ischemic heart disease. Now, the objective here is to improve oxygen delivery to the heart and reduce its oxygen demand. And we have several drug classes that we use, often in combination, to achieve this. The ones we're going to talk about include nitrates, beta blockers, calcium channel blockers, and antiplatelet agents. So nitrates, such as nitroglycerin, they work by dilating veins and coronary arteries, leading to reducing preload and relieving chest pain during angina attacks. So we mainly use it in angina. Now, we're not going to deep dive into the mechanism of action of these drugs in this lecture, but we can just mention, for example, nitrates. So here you see the mechanism of action of nitroglycerin. So nitroglycerin is converted into nitric oxide, or NO. Nitric oxide diffuses into smooth muscle. This activates guanylate cyclase. And guanylate cyclase converts GTP to cyclic GMP. And you can see the nitric oxide shown here. Now, an elevation of cyclic GMP causes smooth muscle relaxation. So the main objective here. And this leads to venodilation. So we have dilated our blood vessels to improve blood flow. Now let's talk about beta blockers. So beta blockers like metoprolol, for example, they lower heart rate and contractility, reducing oxygen demand and helping to prevent future ischemic episodes. So, in short, decrease heart rate and oxygen consumption. Aside from metoprolol, we also have, for example, propranolol, etc. Now, we can mention that we have categories when we talk about beta blockers, like selective beta blockers, etc., and they all differ a little bit. We have a lecture on beta blockers, so make sure to check that out if you want to deep dive into the differences. The next class is calcium channel blockers, such as verapamil, for example. Now, they help by relaxing coronary and peripheral arteries, leading to improved blood flow and reducing afterload. So all in all, they reduce the workload of the heart and dilate the coronary arteries. Then we have the antiplatelet agents. Example is aspirin. So these inhibit platelet aggregation and reduce the risk of thrombus formation, which is a key factor in myocardial infarction prevention, or in the prevention of an MI. So in heart failure, the primary treatment goals are to improve heart function, to reduce symptoms, and slow or prevent disease progression. Here, multiple drug classes are used, often in combination, to target different aspects of the condition. Let's begin with diuretics, such as, for example, furosemide. This helps by reducing fluid overload, which relieves symptoms like shortness of breath and edema, though they don't directly improve survival. Then we had ACE inhibitors, or ARBs. So an ACE inhibitor would be enalapril. An ARB would be losartan. And these lower or reduce afterload and prevent long-term cardiac remodeling, which helps preserve heart structure and function. Then we have beta blockers like carvedilol. You probably noticed now that the beta blockers typically end with lol. So propranolol, metoprolol, etc. Anyway, so these drugs, like carvedilol, play a crucial role by blocking the harmful effects of chronic sympathetic stimulation, which improves survival and reduces hospitalizations. Then we have aldosterone antagonists like spironolactone. These help by reducing fluid retention and myocardial fibrosis, adding further survival benefit in advanced cases. Finally, we can mention positive inotropes such as digoxin. These increase the force of heart contraction and are useful in symptomatic patients, especially those with concurrent atrial fibrillation, though they don't necessarily improve mortality themselves. Now, each of these drugs work by or through a different mechanism, but together they form the cornerstone of effective heart failure management. Now let's focus on how drugs are used to correct abnormal heart rhythms. Now then, let's talk about drugs used to treat arrhythmias. Now, arrhythmias are abnormal heart rhythms that can be too fast, too slow, or irregular. They can range from benign to life-threatening and often require pharmacologic treatment to restore or maintain a normal rhythm. Now, antiarrhythmic drugs are classified using the von Willems system, which organizes them based on their mechanism of action. Here we have class 1, we have class 2, 3, and 4. So class 1 are the sodium channel blockers, class 2, beta blockers, class 3, potassium channel blockers, and class 4, the calcium channel blockers. So the class 1 drugs are sodium channel blockers. They slow electrical conduction in the cardiac tissue. An example is lidocaine, which is class 1B, often used in ventricular arrhythmias. Then we have class 2. These are beta blockers, such as atenolol, and they reduce heart rate and excitability by blocking sympathetic stimulation. They slow rate of depolarization by flattening phase 4 in pacemaker cells. We then have class 3, like amiodarone, and they are potassium channel blockers, and they prolong the refractory period, making it harder for abnormal impulses to restart another beat. Then we have class 4. So these are the calcium channel blockers, like diltiazem. They slow conduction through the AV node. So it's very useful in controlling supraventricular arrhythmias, for example. So each class targets a different phase of the cardiac action potential. And you can see the illustration right here, where drug selection then depends on the type and origin of the arrhythmia. Now, finally, let's address drugs for managing cholesterol and preventing cardiovascular diseases. Now then, let's move on to talk about drugs used to treat hyperlipidemia. Now, the main goal of hyperlipidemia treatment is to lower LDL, which is low-density lipoprotein, often called the quote-unquote bad cholesterol, while increasing HDL, which is high-density lipoprotein, or quote-unquote good cholesterol. Triglyceride levels are also targeted in some patients, of course. Now, key drug classes include statins, fibrates, bile acid sequestrants, and PCSK9 inhibitors. Now, we can just briefly mention two of these here. So statins inhibit cholesterol synthesis in the liver. They do it by inhibiting the enzyme HMG-CoA reductase. And you can see in the illustration right here. So this is the enzyme, and statins inhibit it. And this enzyme is the rate-limiting enzyme in hepatic cholesterol synthesis. So normally the enzyme converts HMG-CoA, seen here, to mevalonate, which is a precursor in the cholesterol bisynthetic pathway. Now, by blocking the enzyme, statins reduce intracellular cholesterol levels in our liver cells or in our hepatocytes. This causes an upregulation of LDL receptors on liver cells, increasing clearance of LDL from our bloodstream. A clinical example could be atorvastatin, widely used for both primary and secondary prevention of cardiovascular disease. And we could take just another example, which are the PCSK9 inhibitors. Now, PCSK9 is a protein that binds to LDL receptors on our liver cells and targets them for lysosomal degradation. Now, the inhibitors are monoclonal antibodies that block this interaction. So by preventing the destruction of LDL receptors, more receptors are recycled and reused, increasing LDL clearance from the bloodstream. Clinical example could be alirocumab, often reserved for patients with familial hypercholesterolemia or those intolerant to statins, for example. So this comprehensive approach here lets clinicians tailor therapy based on the lipid profile and patient risk, whether the focus is on lowering LDL, reducing triglycerides, or raising the good cholesterol, HDL. So in summary then, the conditions we talked about include hypertension, ischemia, heart failure, arrhythmias, hyperlipidemia. Key drug classes we talked about: diuretics, ACE inhibitors, beta blockers, nitrates, statins, and antiarrhythmics. So of course, cardiovascular drugs are life-saving in emergencies and chronic conditions alike. Now this was a general overview of the drugs we use in treating cardiovascular disease. Now we have, or we will have, dedicated lectures on all these different classes. So make sure to click that subscribe, check our channel, and stay tuned. Thank you for listening.